to everybody. Well, here we are. We're 19 months into the virus, and our city and our nation and the world have certainly learned a lot of lessons about the need to be humble in the face of this crisis. The virus has been a wily foe. We have certainly taken a lot of steps to stop COVID-19 in its tracks, and we've seen promising results. And then the virus obviously pivots. Its job is to stay alive and to hurt us. We pivot with it, although oftentimes it has felt like the virus has certainly been a step ahead, most recently with the Delta contagion. When you think about where we're at as a city, unfortunately, this virus has cost more than 1,500 lives in Louisville now. Those are our family members and our friends and our neighbors and coworkers. And when you look back on that, so much of these losses were avoidable because we have a powerful tool in our arsenal that we didn't have toward the beginning of the year. We all know the vaccines between Pfizer and Moderna and Janssen are all safe, highly effective. They are now widely available in Louisville. They're free. You can get them at pharmacies, doctors' offices, mobile missions hosted by our public health team, and great community partners as well. When you think about the difference between the people vaccinated and not, we've seen that about 90% of the people hospitalized with the virus are unvaccinated. So your odds of going to the hospital clearly are way higher if you're not vaccinated, and all the data shows that. So if you're still not vaccinated, please talk to a person that you trust. It could be a doctor or pharmacist. Understand the science because it's the life's work of our physicians and our pharmacists. They can help you. It's their calling. Chat with a vaccinated family member or friend. Ask them why they took the vaccine, how their experience was. You won't regret it. Vaccines are our best tool, but they're not our only tool. We've seen how masks can be really effective in our schools and society. And we know social distancing also is, especially for the unvaccinated, lowers our potential exposures to the virus. So we've learned all about this and many times over here over this past year and a half. Now, another important tool is testing. In a moment, we're going to discuss a really exciting new testing program that we expect will make a big difference in getting our COVID-19 infection numbers down and keeping them down. So that's our major announcement this morning. First, though, let's bring in Dr. Sarah Beth Hartledge. As you all well know by now, she's our Associate Medical Director running our LUVAX efforts, both at broad scale and LUVAX mobile, and she has helped our city in numerous ways. So, Dr. Hartledge, if you would guide us through our data here, I'd appreciate that. So, welcome.
Sure. Thanks, Mayor. So taking a look at our data dashboard, as you mentioned, we've had over 1,500 deaths now. So another milestone that we really never wanted to cross, but there it is. We are still in the red zone with an incidence rate of about 49 cases per 100,000 population. There were a little over 2,600 confirmed new cases last week. We did have 15 additional deaths reported last week. And those are including some young folks. The youngest was 39. So, people in the prime of their life that are contributing to their local economy, and people who have family and friends that will miss them dearly. There was recent national media coverage about an epidemic of children with caregiver loss across the country. So parents and guardians and other trusted adult figures that may have been lost to COVID and what that means for those children. As we see here, we have kind of a bouncing up and down, gentle downward trend, I would say, overall over the past few weeks. So our numbers are still high, certainly compared with those very low numbers that we had in the midsummer, June, July time frame. But we do see a bit of a downward trend. The deaths and hospitalizations update a little bit later in the day. That's just why that last number is so low. But we can go ahead and scroll down a little further. In terms of vaccination, we showed this last week where we have now a third color on our graph here. So we have the orange ones are the first dose, the blue ones are second dose, and the kind of greenish color is the third dose. So now you can see over on the end here, yep, the boosters, those third doses are starting to pick up, and we've kind of leveled off again with the primary and secondary doses. With that said, we've had 56.5% of our population that is fully vaccinated, has completed their series. And then we have about almost 65% of our population that's received at least one dose. And if you cap that by age to only the folks who are eligible for vaccination at this point, so the teenagers and adults, rather than including young children, it's actually about 70%, which is great news. And we also expect to be hearing in the coming weeks about vaccinations for younger kids, the 5 to 11 age set as well. You can see from the map, we have vaccines across the entire area now. Hospitalizations are beginning to trend down. They are still not zero. We certainly still have folks in the hospital. And the very last number there is not yet updated. So the trend is headed downward, which is good news. And the ICU trend is going to be similar. And the ventilator trend as well. Remember that these typically peak a little after the case numbers peak. So if we've passed our peak for case numbers, we can expect to see our hospitalization and ICU and death numbers peak here in the coming weeks. Demographic wise, can we zoom in on the age group one, the bottom one there? Yeah, that'll work. So we do still have cases showing up in the younger folks, often the 20 to 44 age group. Again, we hear from these people over and over again when we do listening sessions, and they say, I'm healthy, I'm young, I'm not going to die from COVID, I don't think I need a vaccination. And so vaccination numbers are relatively low in that age group, and you can see that they are now the majority of our COVID cases being reported. So it may be true that you're not going to die from COVID, but I hope that you don't want to be the test case. I hope you're not the one that finds out you're wrong about that. And I hope that you can also consider your friends, your neighbors, your loved ones. And even if you don't get deathly ill from it, you might carry it to someone else who might have those risk factors. I think that is, yeah, that's it for data. And I just want to emphasize that as the mayor said, we have hundreds of places across the city where you can go and get vaccinated. You can call our helpline or visit our website to help you find a spot. You can go to vaccines.gov. You can text your zip code to get vax. There's many, many ways to get pointed to a local, a vaccine clinic basically in your neighborhood. The vaccines are safe and effective. And it's the strongest step we can take. Over 90% of people hospitalized are not vaccinated. And among those who are hospitalized with a vaccine, many of them have severe underlying conditions, including immunocompromise. So the best thing that you can do for yourself and your family is to get vaccinated. You know, this is Canadian Thanksgiving week. So last year we learned a lot about family gatherings from Canadian Thanksgiving that we were able to apply to our process here in the States. We're a little closer to Halloween, and I think that there's a lot of great things you can do outdoors in that kind of family fall fun business. Go into the pumpkin patch and the hayride or whatever your family likes to participate in. Hopefully the weather will hold and we can continue to do those things. And be able to celebrate Halloween and the fall holidays in a fun and safe way for everyone. Back to you.
All right, thank you, Dr. Hartley. A couple questions for you. So, I mean, it looks like the Delta surge we're declining right now, but as you look now into late fall and the winter time, any concerns about any of the virus, flu, new variants?
So getting your flu shot is definitely a great idea. You definitely do not want to be someone who's co-infected with both influenza and with COVID. It would probably make you feel pretty miserable even if it didn't turn into a severe infection. And you would have an increased risk of severe infection by having them both at the same time. We do think we're seeing Delta starting to decline a little bit. It's definitely still out there. It's definitely still the dominant strain. Delta and the subtypes of it are the dominant strains here locally and in the state of Kentucky. The variant that we're sort of keeping an eye on right now is lambda, which has come out of South America and is widely spread in the southwestern United States. And we have detected it in some wastewater facilities, but we do not have any confirmed human cases here locally yet. So lambda, I think, is the one that we're all sort of crossing our fingers about right now. That appears like it may be our next big foe, but I'm hoping that we at least get a little bit of a break after Delta. So that's what we're keeping an eye on right now.
And do our vaccines work against lambda?
The vaccines to date, we believe that every variant has been covered by the vaccines. Because lambda is coming out of South America, whereas most of our previous variants came out of Europe or the Indian subcontinent, they use similar vaccine products as what we use here in the United States, but the ones in South America are using the same vaccines that they use in China. So it's a little bit of an apples and oranges comparison. And as it's reaching the States now, we're able to get a little bit better data, better science about that, to be sure.
Gotcha. And just any update on vaccine availability for our youngest kids?
The FDA is scheduled to hear from Pfizer and vote on the age 5 to 11 group around the end of October. And then the CDC's Advisory Committee on Immunization Practice, or ACIP, they are scheduled to meet on that topic the first couple days of November. I think it's the 2nd and the 3rd. So it does not look like we will have that in place before Halloween, but I would say definitely before Thanksgiving. So it's coming soon. There's also applications for boosters for Moderna, boosters for Johnson & Johnson, and some other things out there. So lots of exciting and regulatory changes for vaccination, but I do expect to see vaccines for kids all the way down to age 5, certainly by the end of the year.
Good. Okay, well, we need all the tools that we can get. So thank you, Dr. Hartledge. And so folks, when we take a look at the COVID data, it's still clear that we've got far too much COVID-19 in the community that's putting everybody at risk. Same risk groups, seniors in communities, living spaces, to students in the schools. And unfortunately, we also know that there's more of the virus out there, and that's reflected in our data, not just the Delta, but Dr. Hartledge talked about lambda as well. We also have people who are asymptomatic and people who have symptoms but pass it off as something other than the virus. They might think they have allergies or a cold, and even people they might suspect they have COVID, but they're not getting it tested. So it's really important when we try to say, okay, how can we eliminate this, is to make testing as simple as we possibly can, just as we want vaccines today. And so that is the big news that's coming out of this press conference today, is we're launching the Say Yes COVID test program here in Louisville. So we're launching the Say Yes COVID test here in Louisville. So in Louisville zip codes where we're seeing the greatest concerns with the virus, the Say Yes COVID test program will provide households with access to free, rapid COVID-19 test kits that they can self-administer. So free, rapid, self-administer. The test will be available for the next couple months while supplies last. We'll encourage residents in these neighborhoods to use the free test twice a week, regardless of symptoms, to reduce the spread of COVID-19 and keep the community healthy. Louisville Metro residents in the identified zip codes can order testing kits at covidhometestlouisville.org. We've selected these zip codes for a very clear reason. They're the places with the highest risk of lives lost to the virus. They're also communities where we have focused energy on making sure vaccines are available, and will continue that focus. So if you're in one of these zip code areas, there's just more of the virus around you, so you need to do everything you can to get protected. And this testing protocol is part of that. When you think about getting rid of the virus, there is no single solution. And so with the Say Yes program, the idea is simple. Regular testing gives you some peace of mind that you aren't carrying a virus that could be hazardous to your health and a hazard to the health of people that you live with or that you come in contact with. And if you wake up not feeling quite right, you might have a runny nose or a sore throat, you can take a quick, easy at-home test. If you didn't find a virus, that's great news. If you get a positive, you now know and can take steps to take care of yourself by calling our helpline and steps to take care of others by quarantining. So this is a major new test that can be ubiquitous around these neighborhoods. It can be everywhere with the homes, and it's just really easy to take this test. I want to thank and acknowledge the National Institutes of Health, the Centers for Disease Control and Prevention, manufacturer Quidel, healthcare technology company Care Evolution, and of course our public health and wellness team for providing this opportunity. It's a really great thing here for our city. Now, back in early 2020, soon after the pandemic started, our public health team and our healthcare partners got to work setting up sites where people could be tested for COVID-19. Testing obviously has gotten a lot easier since then and has been widely available throughout the community since those early days. And there's no telling how many lives have been saved because of these efforts and efforts from partners like Jefferson County Public Schools. So no matter your zip code, if you've been exposed to the virus or if you're feeling ill, please get tested. If you've got kids in JCPS, it's a good idea to sign them up for free weekly testing so you can have that peace of mind. Now let's hear from Connie Mendel. She's our Assistant Director of Louisville Metro Public Health and Wellness, and she is going to provide us more details. So Connie, welcome. Please tell us how we got this opportunity as a city.
So we're one of 8 cities chosen by the National Institutes of Health and the Centers for Disease Control Prevention to initiate the program. So we were identified based on our very high local infection rates and the public availability of accurate COVID-19 testing and tracking data, and for having the local public health infrastructure to support the project.
Yeah, no, I think that's a real testament to the public health team and overall community effort here that they had confidence that we'd be able to really optimize this program here. So when you talk about the zip codes, maybe you want to go back through that again. I mean, we've been able to, how do we know what zip codes we have the highest infection possibility? And if you want to take us through that.
So, we've been tracking our COVID cases since the beginning of the pandemic. And unfortunately, there aren't enough tests available for every resident over the age of 2 in Jefferson County. But our data has shown that these zip codes have experienced the highest burden of the disease. And they also include people with households with lower incomes, more essential workers, so people that can't work from home. And these zip codes also have the lowest rates of vaccination.
And how about our wastewater analysis?
Also, where we are seeing incidents and evidence of the disease in our wastewater. You're correct.
Okay, and so you've talked to a lot of folks throughout the last 19 months or so. Like, talk about the importance of being able to test at home versus, going to another location.
So, it's interesting. If we go back to the beginning of the pandemic, you couldn't find testing. It was not available. And as you had mentioned, our healthcare systems and here with the health department, we set up a lot of testing available. And now these rapid tests are available, reliable, and available at a lot of pharmacies. So these test kits that are available through this program are very similar to those that are sold at local pharmacies. But now that we've got all the kids back in school and the community's opened back up and many people are returning to their pre-COVID lifestyles or similar to that. So we need to determine, when we wake up and we don't feel well or our kids have a cough or a sneeze or a headache or fever, being able to determine quickly if that's COVID and if it is, using these at-home kits, then we know to keep our kids home. To protect the other students and staff. We know not to go into work or even attending a social event. So, whether that's a concert or a wedding or even going out to the grocery store, having these test kits at home and being able to do a quick test, it just helps us prevent the spread of the disease into the community.
And Connie, how do the tests work?
So they're a quick nasal swab. Swab in each nostril, and then you swirl that swab into a tube that has a liquid, and then there's a dip. You dip a test strip into that tube after that, and the results are ready in 10 minutes.
All right. So we have some home science kits, huh?
Yeah, and there are obviously instructions with each kit and an instructional video. So it'll just walk you through it step by step. They're also on our website. There's plenty of helpful hints, other sources and contacts to reach out to, and as always, our helpline is available um, to walk people through the test. But also, the helpline is available for someone to actually help order the test kits if someone doesn't have access to the internet or just has issue that our call takers on the helpline can order those test kits for you.
Okay. And then how many test kits can someone get?
You can get each house code can get 4 kits, which is 8 tests. So it's a total of 8 tests. And so that's enough for you to take 2 tests a week for 4 weeks. And so the test kits can either be ordered online as through our call center, or there's several locations in town where you can pick up those. And I did want to mention that so if someone is using these test kits and they get a positive test result, that means that it's very highly likely that you have COVID-19 and can spread it to others. So then we encourage them to call our helpline, talk to health professionals, get guidance. Obviously, at this point, you need to isolate, even if you don't have symptoms, even if you feel fine. People need to stay home, isolate themselves, wear a mask around others, and avoid sharing household items. And be sure to clean and disinfect. If it's negative, one thing to remember, it may be too soon after you've been exposed to someone. Sometimes it takes 2 to 3 days. So that's why there are multiple tests in the kit, so you can continue to check at home. That's why frequent testing is recommended.
Yeah. Well, that's fantastic. I mean, when you think about where we were at the beginning of this virus and just really not even knowing how all this was going to work out, and now that we're going to be able to flood the market with home test kits in our most impacted areas that we know through the data, through wastewater, we've made a lot of progress here. And let's hope this fall and winter is when we hopefully really put this virus to bed. And if everybody does the right thing with vaccines and testing, we can certainly do that. So thank you, Connie. We appreciate your good work, you and the entire team at the Public Health Department. So with that, Kathy, I'll throw it back to you.
Okay, thank you, Mayor. First question is for Dr. Hartledge from Sarah Ladd. Dr. Hartledge said the lambda variant had been detected in wastewater facilities. That means it's been detected in Louisville wastewater, correct? Or were you referring to somewhere else, Dr. Hartledge? And Dr. Hartledge, you're on mute.
Hey, sorry about that. The lambda variant has been detected at a very low level in some wastewater sampling in town. But as I said, we do not have any human cases. It's not correlated to any confirmed cases in people at this point.
And I think, Dr. Hartledge, we've been seeing that now for the last 3 or 4 weeks. Does that sound right?
I don't know exactly how many, but at least for a couple of weeks, we have seen a low level background of lambda and a couple other variants of concern or variants of interest, according to the CDC and WHO classifications.
And we haven't seen any kind of exponential growth in those like we saw with Delta.
Not yet, no. It's just kind of a constant low background level. I think they're getting it in about 1 in 5 samples from some parts of the city, but nothing. It's not like Delta where it's in 100% of the samples.
Thanks.
Okay, thank you. This question is from Jose Donis. Is the COVID-19 home test accepted for traveling? Connie, do you want to address that?
Sure. It basically depends on who's requiring the test. I will say most antigen tests are accepted if they're administered by a healthcare professional. as far as a negative test for potentially work or some of the programs to return to school. So antigen tests is acceptable, but not typically an at-home test. Usually those do need to be administered by a health professional. But it does provide great information to you. If your at-home test is positive, you should not be traveling.
Okay, thank you. And another question from Jose is, in what places can people get the kits if not online? Chris, could you bring up the website that we showed some of the partner locations? And then Connie, do you want to address, are there additional partners that will be added where people can pick up the kits?
So there's some of the locations there. These are the ones that have kits in hand. They should be ready to distribute. Be sure you check their hours of operations. We don't want to overwhelm them. And then this is just week 1. So next week we'll be rolling out, and even potentially later this week, additional locations, including many of our Metro Parks community centers and library locations and some additional healthcare providers.
Okay, thank you. And Sarah Ladd is asking, how many total at-home tests does the city have to distribute through the program? Connie?
Yeah. So the National Institutes of Health are providing up to 1 million tests, which basically equates to providing those 8 tests to 125,000 households in Metro Louisville.
Okay, thank you. As a follow-up to Jose, do we want to emphasize that if someone cannot get the kit online or from one of the community partners, they can call the COVID helpline, and the helpline will be able to get the kits to them as well. Okay,
Correct.
from Wave 3, is the free COVID at-home testing kit available to people in zip codes regardless of vaccination status?
Yes.
Connie?
So
Yeah.
yeah, those test kits are available to anyone in that zip code, because we do know that even if we're fully vaccinated, there is a chance of still contracting COVID. Although those who have been fully vaccinated have a much less severe case in most cases, and then also passing that on to others. So they're available regardless of vaccination status.
Okay, thank you. And this question is from Bria Jones of WFPL. Are there plans to re-up the number of test kits in order to continue the program beyond this first run? Ani?
Not at this time. We are hugely excited just to be provided this many test kits for our community members, particularly to those zip codes who've had the worst effects, the highest burden of COVID. Again, these were provided to us through the Institutes of Health and the CDC. Again, we're just really looking forward to kicking off this and getting a lot of testing available out into our community.
Okay, and then a follow-up from Wave 3 for you, Connie, is how long will these free tests be offered? And if someone tests positive, do they need to report it to the health department? So what should they do if they test positive?
So there are instructions on what to do, test positive. So in addition to isolating, which is a huge, that's the most important piece, not spreading it further. There is a reporting option, although it's not required for anyone. We encourage those to follow the instructions included with the test kits to report. And there's also the availability for up to a $35 gift card for anyone willing to take a short survey and reporting those results, whether negative or positive. And then obviously if there's a positive, again, please contact us through our helpline if you test positive with the kit.
Okay, thank you. This question is from Jose. He's a follow-up to his traveling question. For traveling, he meant airlines. They require vaccination proof or a negative test. Are the home tests valid for this?
I'm not familiar with each airline's policies, but I would assume that an at-home test would not be suffice for negative for travel. And then
That's
I also,
correct.
okay,
Sorry, that's
thank you.
correct. Most airlines will accept an antigen test, but only if it's administered by a healthcare provider.
Thank you. And then I did wanted someone asked previously how long they would be offered. This is 5 weeks is the initial program. We can extend that out further if we need to distribute, but generally we're doing what we can, and we will have the program will be open until we can get all of these kits distributed and handed out.
Can everyone hear me? 'Cause
Yeah, you're back.
Okay, my WebEx just froze. I apologize. This question is from Natasha Williams. The tests are being offered in several zip codes. How many in total? Connie, I believe I counted 16. Is that correct?
You're correct. 16 zip codes. Thank you, Chris, for showing that slide again with the zip codes.
Yeah, thank you. And that is the website, covidhometestlouisville.org. This last question from WLKY. Dr. Hartledge, I will ask you, is there a limited availability of the J&J vaccine?
At Public Health, we continue to have all 3 vaccines in stock and have been able to place orders for additional vaccines when needed. We try not to carry a enormous inventory so that can be used elsewhere by others who may need it, but we do have some J&J, we have Moderna, we have Pfizer, and we use those specifically for different types of events and populations, but we have not had any difficulty placing orders for J&J or any other product at this time. Seems that supply is not terribly limited right now.
Okay, thank you. Mayor, that was the last question in the chat.
All right, thanks, Kathy, and thanks everybody for joining us today. Just reminders, if you're not vaccinated, please do so. Say yes to the test for the folks that are in the identified zip codes as well. And these are all the ways that we can help each other get through this virus and this pandemic, which we want to go away. So thanks for joining us today, and we'll see you next week.